For now, the proposal includes requiring the employee or the employer to apply for a 1,000 peso deduction per month when filing the income tax return. Another option is for businesses to grant workers an additional 1,000 pesos every month. With cases surging domestically and globally, the race is on to find a cure against coronavirus. But while that's yet to happen, some resort to convalescent plasma therapy to fight off the virus, especially those who are severely affected. To discuss their latest developments on that front, we have Dr. Francisco Lopez. He is the head of the Blood and Marrow Transplant Service over at St. Luke's Medical Center in Global City. Good morning, Doc Lopez. Great to have you here with us on the show.
Good morning, Jess. Thank you also for having me in your show.
Okay, first off, let's explain what exactly is convalescent plasma and how crucial is it in the fight against COVID-19?
Well, convalescent plasma is taken from a patient who has recovered from the infection of the COVID-19 infection. So plasma is the fluid portion of our blood, and in the plasma, it contains the antibodies that the body produces, and we collect the plasma that is now rich in antibodies, and that is what we call convalescent plasma. And how is it crucial? We have patients who are still critically ill, and if we label them critically ill when they are in a mechanical ventilator, and we have those who are progressing to severe illness, and these are the patients who require more oxygen and their chest X-ray is getting worse. And these are the two groups of patients that we give the convalescent plasma to.
Mm-hmm. Now, question is, has there been enough clinical trials to prove its efficacy and safety? We're talking trials done here in the Philippines as well as overseas.
Well, overseas, yes. Now, as early as March, we already had data coming out from China, case series, and using the convalescent plasma to critically ill patients. And of course, here in St. Luke's, we also have our own study using it and our own data already. Now, recently, China came out with a randomized trial giving a small number, though, 103 patients, giving plasma to some and plasma to others. And basically, for those who were not critically ill, it did show some improvement, which I would just like to highlight, if you don't mind. In our experience here in St. Luke's, we see better results when the plasma is given to those who are progressing to severe illness, meaning they are not yet in the ventilator, and to those patients who receive the plasma within 14 days. As you see, the plasma is rich in antibodies. So when the plasma enters or is infused to the patient, these antibodies immediately neutralize the virus. And so this whole domino effect that we see, that the virus starts to attach itself to the different organs in our body. First is the lungs, and then the other tissues will follow. Then you have this destruction of these tissues, and then you have this inflammatory response that we always call, or we always say when you have the infection. So when we see it right away, or in some patients or majority of our patients, that when we give the plasma within that golden period of 14 days, and they are not yet in the ventilator, we see them improve immediately.
Mm-hmm. And question is, how far along are you when it comes to your testing procedures here for convalescent plasma therapy? Do you have a specific time frame here for you to actually just fully roll out this therapy, or is it already something that you've been fully implementing as we speak?
Yeah, we started last April 11th. And as of today, they have already 38 recipients here in St. Luke's. And based from our data, it seems to be consistent with other countries also. Give it early and give it to those who are not yet critically ill. And if you give it later on, then the results are not as good, or there's no difference anymore. That's what we would like to call it. We've also given plasma to last 2 weeks ago and last week to Cebu because they were in need of plasma. They don't have yet donors or enough donors to get plasma from. And also we launched a project with Security Bank Corporation to give plasma to those who cannot afford. No? And we're very happy that Gets Healthcare Philippines now donated a new machine that exclusively collects plasma from the donors. No? So we're moving, yes, moving on, and then we have 38 recipients already, as of today. And we've seen the shift, no, of the way our COVID team. Now we have an exclusive doctors of infectious disease and pulmonologists taking care of our COVID patients, and we've seen the shift, no, of how we give it, no, from critically ill. Now we give it early on, no, before they even get intubated or placed in the ventilator.
All right, so, some developments when it comes to at least the admission of the therapy here. But at the same
Yes,
time, I would like to ask regarding the track record of a convalescent plasma therapy. When it comes to treating previous outbreaks, I guess this is something also that we
yes,
have to look up.
yes.
How successful was it actually in curing a previous outbreaks? You have the likes of H1N1, SARS-CoV, and even MERS-CoV.
Yeah. So again, the theory is nothing new. This is what we call passive therapy. Because you're giving already the antibodies. The active therapy is the vaccine that we're all waiting for. Because you're going to allow the body to make its own immune antibodies based on the vaccine. When it's given. But this is what we call passive therapy because you already have the antibodies in the plasma. And that's why that's what we learned, from the past to give the plasma. And as early as March of this year, US FDA already approved giving the plasma to critically ill patients as early as March of this year.
Mhm. And at the same time, would you consider CPT a primary treatment for COVID-19, or is it more of an adjunctive therapy?
I think at this time we give it with other medications, like remdesivir. And remember, dexamethasone is not really a medicine for COVID-19. It is given to decrease the inflammation. So those are two different things. Remdesivir is really for the virus, and so is the convalescent plasma.
Mhm. Now, in this time of the pandemic, how crucial is it for medical facilities, especially in the Philippines, both public and private, to establish plasma banks or at least have plasma collection capabilities?
I think it's one of the what we say armamentarium in the treatment of the COVID-19. And if hospitals can also establish their own uh, facility to collect, that will be beneficial for all. Now we've gotten phone calls from different hospitals inquiring about our supply here, and which brings me to the next point. If you, I hope you don't mind. No, we really need donors, because we can only help others if we have enough donors and we have supply of CP as well. No.
Mhm, mhm, mhm. How exactly can interested donors actually come to St. Luke's or at least approach your facility for donations?
Yeah. We have a contact number, a cell phone number that they can call, and they will be given instruction as to where to proceed. And first, we do is, well, of course, the patient has to be a recovered COVID patient, no? Age between 18 to 65 years old, and at least a negative swab, no, for the COVID-19. No? Here in St. Luke's, we do check their antibodies, to make sure that they do have antibodies already. And from that, we then do other screening tests for infectious disease. And if they pass, then we start to collect.
But at the same time, is it a point of concern? Because I do remember some cases who already tested negative for the virus after testing positive, and then eventually you have the virus recurring. So is that also a point of concern here when it comes to administering convalescent plasma therapy?
Well, that's a good point. No? When they repeat, are you referring to the repeat nasal swab?
Yes.
Yeah,
Mm-hmm.
again, we don't know, and they all say that these are just remnants of the coronavirus, no, these particles, no. But again, we always err on the safe side. So both on the donor and also on the recipient, no? Because we're never sure, and so we only accept those who have been tested negative, no? Uh, as per our protocol and guidelines.
Mm-hmm, mm-hmm. Now, some like what you mentioned earlier, have some developments on that front. You have that state-of-the-art convalescent plasma machine. Are you further planning to expand this particular development here? Are you planning to at least get more of the equipment?
Well, the machine, the apheresis, we call it an apheresis machine, no,
Mhm.
was actually donated to us, no, by Gets Healthcare Philippines. They gave us two machines, and we're starting to use these machines, and the collection is faster, no, within 40 minutes sometimes if we're done, and we can collect as much as 1,000 cc, so that's 1 liter. But we haven't done that yet because our protocol and the guidelines have mentioned only to collect 500 ml. No? So can you imagine if we collect 1,000 cc's from you? No? So we have to be really careful about that. No? But
All right.
yes, we've been using our new machines.
All right, at least some developments on convalescent plasma therapy, specifically coming from St. Luke's Global City. Thank you very much, Dr. Francisco Lopez, for your time. He is the head of a blood and marrow transplant service over at St. Luke's Medical Center in Global City.
Thank you, Jess. Thank you for
Thanks.
having me in your program. Thank you.